Hello and welcome. This is Borno Restoration. I am Jesse Tafida. Today on the program, we will track down efforts by Governor Babagana Zulum in improving healthcare delivery to the people of Borno State. This sector is one of the priorities of the Zulum's 10-pact development agenda of the state. But before we track these stories, let's bring you the latest on Borno today. Munakumburi IDP camp, a home to over 1,000 displaced persons. The streets of the camp are busy with IDPs, mostly children roaming about. Some men in the camp are engaged in handiwork just to find a way to cater for their families. The National Emergency Management Agency and the King Salman Humanitarian Aid and Relief Center are here to distribute food items to the IDPs.
The camp is one of the designated camps where we want to distribute relief items. We were here last month. 5 camps benefited from the same relief baskets. 8,000 households benefited. Like I told you initially, 16,000 food baskets. That means for 16,000 households. So 8,000 was distributed last month, so today is a continuation of the second cycle. My message to the beneficiaries is that they should please ensure they utilize these items for themselves.
I met 75-year-old Ali Musa, who said life in the camp cannot be compared to home. He yearns to go back so that he can go to the farm with his children. He says, I've been in this camp for 9 years. My family came from Burma during the peak of the insurgency. Life here is not like home, but I'm happy to be part of today's beneficiaries. This gesture will greatly assist in feeding my wife and 9 children. The King Salman Humanitarian Aid and NEMA say they will stretch out the gesture to other camps and host communities across the state so as to alleviate the hardship of the IDPs. In August 2019, exactly 3 months after the inauguration of the executive governor of Borno State, Professor Babagana Zulum, he assented to a bill establishing the Borno State Contributory Healthcare Management Agency and later appoint the pioneer executive secretary, Dr. Saleh Abakaza, young and dedicated person who has been doing a lot in helping the vulnerable people of Borno access to health care through a new program known as the Zulum Special Health Intervention Program. Take a listen.
We have a very important program we are actually promoting, which is the Zulum Special Health Intervention Program. This intervention health program is actually meant for vulnerable citizens of Borno State. And amongst the vulnerable, we are concentrating on about 5 categories of vulnerability. One is the pregnant women, children below the age of 5, that is under 5 children. Then we have the people living with disability. We have the elderly people or the aged, and then the poorest of the poor, among others. And then we also have another category, which is actually we used to tag as those people with special needs. These are 5 categories of individuals or vulnerable people that we are actually concentrating. The Zulum Special Health Intervention Program is from His Excellency. Actually, it is out of his own passion towards healthcare that he made this funding available. And from our take-up, he was able to release 100 million to the agency, so that the agency could do some of those activities, including disastership activities. And out of this funding is what we have been using for the past 2 years to ensure that those things have been taken care of. And then other sources of funding that we are expecting is actually from the philanthropists, so that they can also key into this program, and then so that we can actually maintain the program from rolling. So it is the health workers in those facilities which we have highlighted, or which we have enlightened about the Z-ship, that used to identify those individuals, and then they forward their request to intervene as such. So this is how we used to do the selections. And after that has been done from the facility level, from the healthcare workers, so our agents there in the agency, that is the BOSHMA agents there in our agency, used to go to actually verify and validate whether this person is actually needing such intervention or not. And why we do this is because the needs are actually enormous, while the resources are scarce, we know. So no matter how much you have injected into such society with this margin of vulnerability, or this margin of poor people that we are saying about 73% of them, you find out that your resources may not actually go around. And that was why we have to identify, even among the poor, we have to identify those that are in very, very need, in real need of such intervention.
biyar ina ta shan wahala har yanzu ina zuwa asibiti, kuma alhali bana da gata. Na yi wannan ma da kyar aka taimake ni ma ba hannu a wajen. Ni ina kasuwa ne, na sai da magunguna kemis, bana da komai. Yanzu komai harka ya tsaya cak, ban da wahala ba komai a kai wajen. Kasuwa ya tsaya cak, yau shekara 5 da wani abu, kasuwa ya tsaya cak. To ba na da dama zuwa yi, ba na iya tashi, ba na iya zo na kasuwan ma ya tsaya. Amma inda hali in na samu dan canji, zan iya bude kasuwa din, ko ina zama kasa ma zan iya samu abin da zan ci da yalina. Kaga yalina suna kara su yanzu hakan a kuda. Yau wata 5 suka zo daga Kolofata, su ma ba su samu abinci ba. Haka suke su. Na da mata 3, yara na 19.
Yaron ya yi rashin lafiya da dama, kuma yau at least yana asibiti ya kai kwana 40, zuwa wata 2 da yake nema yanzu. Kwana 40 ne tun a sallah, gobe sallah ne muka yi masa operation, amma bai samu lafiyan ba har yau, kuma yanzu karfinmu ya kare.
For the people, we covered the basic health needs for those people, and in some cases we even go beyond just covering their drugs and then other related hospital bills like their bed fee and other things like that. We even go beyond looking for to source for funds for them, even for their feeding, and because as they stay in hospital, definitely they need to actually feed themselves, and those individuals are people that don't even have transport money to even transport themselves from their houses down to the hospitals. And that was why you see a lot of them cooking within the hospital premises, so that at least they will have something to eat, to give to the patient to eat, and also for them to also eat and other things like that. And it is very, very inconvenient for them. So as such, and then another thing is that those people that usually used to stay that long in hospitals, you find out that even after they are discharged, they end up maybe losing their jobs, or they end up being uprooted from their usual means of livelihood. So before they go, so those people, sometimes they may need some therapy. It might be occupational therapy. Among the other classes of people that we also identify are those people that are orphans, and those people that we used to call them the unaccompanied children as well. The unaccompanied children is because of the a decade-long insurgency, which is about 12 years now in the 13th year. You realize that we have a very large number of population that has been displaced, which was around getting to about 2 million or more in people, including the children. And as such, there are among them those unaccompanied children and those orphans among them, which may also need such intervention. And we also have those people that have mental disabilities. Sometimes you will see a lot of people roaming about the street because of mental illness, and then their families could not be identified or so. So we also intervene in such cases if we identify such individuals, and then we will see how we can even get the care, the necessary care that they needed, and also to help them trace their families. And we do that in collaboration with many stakeholders, including the civil society organizations, not only the government apparatus, but also the private apparatus, as well as the
sunana Abubakar Muhammad, ina anguwan Budim, yanzu haka ina cikin General Hospital. Da farko zan yi godiya a Boshma wanda ta dauki nauyin in mana aiki na tiyata da sauran magunguna. Na gode masa da ma'aikatansa gaba daya. Kuma a gaskiya yanzu mun samu lafiya, muna ganin aikin da aka yi na yanzu an dace, kuma alhamdulillah yaro ya dan samu lafiya, yana maganansa, yana neman har sauran, yana neman a bashi abinci mai ci, amma da yake yanzu ba zai yi ba, sai doktoci sun faɗa cewa mu bashi abu, za mu bashi. Yanzu ya dauki tsohon kwana 2 da wani abu an masa aiki, alhamdulillah. Mun gode ya Boshma.
Rashin kuɗin ne ya sa ba mana aiki da wuri ba, amma to yanzu mun samu an mana tallafi, an taimaka, yanzu mun samu aiki. Na gode Allah ya saka wanda ya mana wannan abun, muna mishi godiya sosai.
Victim of gunshot injury, where there's some bone loss, and he had multiple fractures on his his left thigh and hip. So he had an initial surgery in Dala where he spent a lot of money, but the fracture did not unite. So he had to come back here. And luckily, Boshma came in to help him. He had surgery. He had a series of surgeries here, about the 3rd one. So what we are trying to do now is to unite the bone and elongate the bone, because the leg is shorter. So we are trying to equalize the length of the left leg so that it will be the same with the opposite one. That is so far what has happened. A lot of things could have happened, as simple as losing the limb from infection to losing his life, actually, because infection of the bone is a very serious thing. It can lead to severe sepsis that may lead to end of life to a patient, actually. I saw him this afternoon. He's doing very well. The elongation is progressing and he's gaining length every day. He's doing very well. He's happy.
Ina godiya ga Allah sarki Ubangiji da bayan da aka yi mana tiyata biyu. Ina godiya yanzu jikina din akwai soki. Mun aiki da yanzu din akwai bambanci har ina iya soka ina tattakawa ina ta adjust din duk akwai soki alhamdulillah. Baba Umar Zulum, Allah ya sa Ubangiji ya tabbatar mana da alheri. Ina godiya sosai da zuwan da muka haɗu da Boschman da Dr. Salen da ya zo ya haɗa mu duka gaba daya. Ina murna ina taya ku godiya.
It's actually very useful, but it's equally very expensive. Orthopedic surgeries are actually very expensive, so this is where this kind of schemes like the contributory healthcare scheme comes into play. And I call on the general public, those that really have the means. There are a lot of such patients outside that could not access this kind of care because of lack of funds. So philanthropists can come in, sponsor such patients. It will go a long way. This is a man that has 3 wives before now, but now he's living in an IDP camp and it's not his making. This can happen to anybody. That is my call, actually.
Yanzu wannan dai da ya same ni yau shekara guda kenan, daga ƙaiƙayin ciwon ido kuma shi kenan sai hazo ya shiga. Da wannan ne yake ciwo kuma wannan ma ya karba, yanzu duk bana gani gaba ɗaya. To shine zan ce wannan dai sai dai Allah ya saka muku da alkhairi, Allah sa race.
Assalamu alaikum, ni da sunana Aisha Ibrahim, mahaifiyata sunanta Rabi Abdullahi. Yau shekara ɗaya baya ba ta da lafiyar ido. Mun zo ganin likita yanzu akan a ga lafiyar idonta, an duba an ce aiki za a yi mata. To an sa hannu akan za a yi mana aikin kyauta. Allah ya saka da alkhairi, mun gode, Allah ya biya, Allah ya taimaka, Allah ya sa a dade ana yi, Allah ya ba ta lafiya ita.
The condition of the patient is cataract blind. And as we all know that cataract is simply a cloudiness of the lens inside the eye, which is supposed to make you see clearly. And one of the most common cause of blindness worldwide is cataract. And blindness due to cataract is reversible, in that by simply extracting that cloudy lens and replacing it with a clear artificial lens, vision is restored. And the aim of taking her for surgery is to restore the vision of the patient. The most common cause of cataract is age-related. That is due to aging. So, because a higher percentage of the cataract blind are the aged ones, and they are not economically productive, actually. And one of the barriers to uptake of going for this procedure, looking for medical attention so that you get your vision restored, one of the barriers is the cost. So most of them cannot afford it. So we're really grateful. We're happy to see that Boschma has intervened this time around to take up the responsibility of the cost so that this patient can have his vision restored.
One major issue that we are facing in Borno State is that we have a larger number of people that are not covered by any health insurance scheme or contributory health scheme. More than 90% of the individuals in Borno State, or even getting to about 95% of the people in Borno State, are not insured by health insurance coverage. And even the registration at the contributory health care level is a bit very, very low. So as such, we are using also this medium to sensitize people that taking care of the health care, they have to actually change their health-seeking behavior to a very positive one, because health is wealth, and without health we cannot develop. To ensure the smooth operationalization of this program, the agency is working alongside stakeholders, especially the Ministry of Health, which is the mother ministry, and then the State Primary Healthcare Development Agency, as well as the Hospital Management Board, which are responsible for the primary healthcare centers and the secondary healthcare facilities, respectively. At the same time, we are also working hand in hand with the Agency for Sustainable Development, and then all the other stakeholders, including the civil society organization, development and the humanitarian partners, as well as the philanthropists within the state.
Fama da matsalar dialysis ne kadan, so ko gashi na samu an taimaka mun yi successfully without any problem. Yes, so actually ana yin sa very expensive teaching hospital and other places. But abu ana an yi wannan shi free, state government. Wata wani sun taimaka da yake ba ni kaɗai ba da su sun taimaka, ana samun short ɗin materials na dialysis. In fact, for the past 15 days mun samu shortage ɗinsa, so ba sun yi ƙoƙari sun an samu sun taimaka sun kawo, kuma ya taimaki mutane da yawa.
This is our patient Aji Mohammed Kirawa. He's our staff here in this place. That's a state specialist hospital. So he has end-stage renal disease, or what we call kidney disease in general. So, and this kidney disease, ultimately what it means is that the kidney cannot function. That's the normal function that the kidney used to carry out. The kidney cannot do it anymore. So this patient is supposed to be on a supportive treatment, what we call either hemodialysis or peritoneal dialysis, or ultimately a renal transplant. So now what the patient is undergoing now, the patient is undergoing hemodialysis. This hemodialysis is what the kidney is doing, that this hemodialysis machine is doing to the patient. Fortunately, is that the state government has took this therapy or the treatment free of charge. So the patients were not paying a kobo for this particular treatment. Where else, if you can do it somewhere else where they are paying, I think maybe virtually for a session, a patient may spend up to 30,000 naira, of which the patient requires at least 2 sessions in a week or more than that. So I think Bochuma is important here, maybe as it is implies that the patient is a staff of state, and Bochuma covers the patients that work in the state. Now, as it is now, this month, particularly this month, we have about 62 patients that are coming for dialysis.
So this program is also part of the component of the 10-pact agenda of His Excellency Professor Babagana Umara Zulum, CON, MNI, FNSC, and at the same time the 25 years development plan of the state, as well as the 10 years strategic development plan for the state.
And that's our package on this episode of Borno Restoration. Thanks for watching. I am Jesse Tafida. See you next time. Bye-bye.